Are you caring for a loved one with dementia? You don't have to figure this out all on your own. Welcome to Truth, Lies, and Alzheimer's, the show that helps you reimagine a new relationship with your loved one, a relationship a little more free of stress and anxiety. Join host Lisa Skinner and her 30-plus years of experience as she guides you on a new path to a better relationship with those you care for. Here's Lisa.
Hello, everyone. Welcome to another episode of the Truth, Lies, and Alzheimer's Show. Well, I hope you all know me by now, but if you're new to the show, I'm Lisa Skinner, your host. As we know, there currently is, sadly, no cure for Alzheimer's disease and other dementia. However, we now know that there are ways that we can reduce the likelihood of experiencing cognitive decline. Now, according to research from the Lancet Commission, about 45% of dementia cases may be preventable if people address modifiable risk factors. And I want to add that they just increased that statistic from 40% to 45%. So, these studies and evidence-based research that have been going on for decades are really demonstrating that they are effective. So that's what I'm going to talk to you about today. And of course, as we all know, Alzheimer's disease is a progressive degenerative disorder that attacks the brain's nerve cells, causing symptoms such as memory loss. This irreversible condition impacts more than 7 million Americans today. And anybody who has entered the dementia world knows that it takes a toll on the people who are living with it, the care partners, and the healthcare providers, along with our family members, loved ones. Now, again, Alzheimer's disease is a type of dementia, which encompasses other diseases of cognitive decline. We know there are over 100. And these diseases are a leading cause of death among older adults. As a matter of fact, about 1 in 3 seniors die from Alzheimer's disease or one of the other brain diseases that causes dementia. And that is according to the Alzheimer's Association. So here are Alzheimer's disease and dementia by the numbers. Alzheimer's is the most common form of dementia. The number of people living with Alzheimer's has risen in recent years and is expected to keep rising. I've mentioned this many times before, but I'm going to tell you again. By the year 2050, the Alzheimer's Association predicts, and also the World Health Organization is saying exactly the same thing, that nearly 13 million Americans will be living with Alzheimer's disease, and that's just Alzheimer's disease, by the year 2050. Now, while Alzheimer's and dementia are increasingly common, they are not a part of normal aging. So it's very important that we talk with our doctors about our own potential risk level and bring up any concerns you have for you or a loved one's memory as you continue to age. So, can Alzheimer's disease be prevented? Currently, there's no cure for Alzheimer's disease or any of the other brain diseases that cause dementia, or even a tried and true method for preventing cognitive disease either. But there are many ways to reduce our risk of cognitive decline. And again, according to the Lancet Commission, eliminating 14 potentially modifiable risk factors from our lives may actually help us prevent developing Alzheimer's disease and related dementia. So here are the potentially modifiable risk factors, the 14 that they are letting us know about. And they include, this one has moved way to the top of the list, hearing loss. It has now been substantiated that hearing loss is one of the highest risk factors that we know of that will contribute to us developing Alzheimer's disease. Having high LDL cholesterol, a lower education level, particularly early in life. The reason why is because you don't give yourself the same opportunity to build that neuroplasticity and cognitive reserve that folks who have more advanced educations. Depression is high. Traumatic brain injuries are now proving to be a very high risk for developing dementia. Physical inactivity, diabetes, smoking, hypertension, obesity, excessive alcohol use, social isolation in elder years, and we have really been made aware of that as a result of what we saw during COVID. Exposure to air pollution later in life, and then the last one is vision loss in our later years. But I want to emphasize that not all of these factors are modifiable for everyone. And some perceivably healthy people will still end up with Alzheimer's disease. It does not discriminate. It can pick on anybody at any time, but at least now we know there are things that we can do to lower that risk. But like everything else, more research is underway about the disease and more answers are yet to be uncovered. I actually have been blown away at the progress that research has made just in the last few years. And it continues to bring to light so many new discoveries. So that's, for me, I think, just such a positive indication that we are on track for discovering either a treatment or a cure in the near future. Still, experts suggest that practicing certain healthy habits may actually really reduce our Alzheimer's risks. This is a quote. Most of the risk of Alzheimer's disease seems to be determined by genetic makeup and factors that are yet to be determined. And Dr. S. Ahmad Sajadi is telling us that, and he's a neurologist at UCI Health and an associate professor of neurology at UCI School of Medicine in Orange County, California. A lot of people want to know, is Alzheimer's hereditary? This is the answer. People with a family history of Alzheimer's disease may be more likely to develop the disease, according to the Alzheimer's Association. But again, not everybody with a family history of Alzheimer's will end up developing it. I hope that's true because I have had 8 family members who have lived with one of these brain diseases that causes dementia, and 5 of those are blood relatives. So you think that might increase my risk? Yeah. So here are 11 simple ways to reduce our dementia risk. And while these methods are certainly not guaranteed to spare us from developing disease, Following them may definitely help reduce our risks. So, this is the question. What should we do after a dementia screening? And I'm going to explain the science behind dementia prevention. This is all science and evidence-based fact. Recent research has revealed new detection methods for Alzheimer's and dementia, as well as new thoughts on best practices for that prevention. So here we go. Number one, structured lifestyle changes. Research has shown that we can strengthen our cognition and reduce our risk for cognitive decline if we follow a structured model paired with coaching and support. According to findings from the 2025-2026 U.S. Pointer Study, so this is very recent, which tested 2 lifestyle programs in more than 2,000 older adults, structured programs appear to be much more successful at preventing dementia than self-guided tactics. Now, Dr. Adil Papalatza, a board-certified neurologist and the stroke medical director at Pomona Valley Hospital Medical Center, explains that consistency matters more than intention. He says, most people already know they should exercise, eat well, and sleep better. Yeah? And structured programs to turn good intentions into regular habits. Alzheimer's risk is multidimensional. It is influenced by physical activity, diet, sleep, vascular health, mental stimulation, and social connection. Now, structured programs intentionally address all of these together rather than focusing on just one area or discipline. Structured programs may also help patients measure health metrics and track behaviors, which can hold them accountable to changing bad habits, he adds. And this may lead to improved health outcomes in the future. He also tells us in simple terms, behavior change is far more likely to stick when it is supported by structure and accountability. Structured interventions can take place in team group settings or classes, but they don't have to. You can still create structure by putting activities on a calendar, using simple tracking tools, exercising with a partner, and scheduling regular health check-ins with your healthcare provider. Some areas where structured lifestyle interventions may help prevent Alzheimer's and dementia include planned exercise, nutrition guidance, cognitive and social engagement, sleep support, and health monitoring. There's also the biomarkers for early detection. Researchers have also discovered biomarkers in the body that offer clues about cognitive future. I've mentioned this one before. The p-tau217 is one such biomarker. It's a blood biomarker that reflects activity from the tau protein, which is closely linked to amyloid buildup in the brain and can occur during Alzheimer's disease. Doctors can actually now test your p-tau17 levels through a p-tau217 blood test, which, when paired with other diagnostic information, can help inform your doctor if you are at risk for Alzheimer's disease. So what exactly are p-tau217 blood tests? Well, they're blood tests that check for normal tau changes that may be associated with Alzheimer's-related amyloid buildup in our brains. Seeing this change in the blood does suggest those Alzheimer's type processes may be happening in the brain, Dr. Popolazzi says. These tests help identify the likelihood that a patient with cognitive symptoms also has Alzheimer's related biology, but do not diagnose Alzheimer's, he adds. In 2025, the U.S. Food and Drug Administration, also known as the FDA, cleared a p-tau blood test known as LumiPulse-G, p-tau 17, b-amyloid 1-42 plasma ratio to assist in Alzheimer's disease diagnoses. So this is really fairly new. This test measures two proteins in our blood, including the p-tau 217 protein, and your b-amyloid 1-42 protein. And it provides data on whether there are or aren't amyloid plaques existing in our brain. This test cannot diagnose Alzheimer's disease alone. We still don't have means to do that. This is getting much, much closer and must be paired with other diagnostic tools like clinical evaluations. Now, downside, due to their limitations, these p-tau 217 blood tests are not recommended for asymptomatic individuals. In other words, people who are showing no signs or symptoms of Alzheimer's disease. But it may still be recommended for people with new or unexplained cognitive symptoms, or those who are under evaluation for a neurodegenerative disease. Among the intended populations, and this is another quote, people can use results to better understand their risk, guide next diagnostic steps, determine their eligibility for treatments or clinical trials, and motivate more intensive prevention strategies. And this comes again from Dr. Popolazzi. He also says this shifts the focus towards earlier and more proactive intervention. That's a huge stride. Vascular health, the brain-body connection. According to the 2024 Lancet Commission, highlights LDL cholesterol and other vascular conditions as modifiable risk factors for Alzheimer's and dementia. Properly managing vascular risks, including managing blood pressure, cholesterol, and diabetes, can benefit your cognitive health, but neglecting your vascular health can definitely hurt it. Dr. Dong Trin, an internist at Memorial Care Medical Group in Irvine, California, who is also the chief medical officer of the Healthy Brain Clinic, says that it's important that people control their blood pressure, especially in midlife, as high blood pressure can and does contribute to cognitive impairment and dementia. Environmental risks for cognitive decline. It's not just your own actions that increase or decrease your risk of cognitive decline. The world around us plays a huge role as well. Environmental risks can threaten various aspects of our health, and that includes brain function and cognition. So staying aware of environmental hazards out there and taking steps to avoid or mitigate them when possible may help you preserve your brain function in the long term. Some of the steps we can take to minimize our environmental risks include reducing exposure to air pollution, improving the air quality in our homes through steps like having proper ventilation and filters, reducing exposure to toxic chemicals, drinking clean water, creating a safe home environment that minimizes risks for falling and head injuries, practicing strength and balance training to safely navigate obstacles like stairs or uneven ground. Also, addressing depression, anxiety, and chronic stress matters. Maintaining social engagement matters. Dr. Papalazzi tells us that many of these changes are simple, but they're powerful when applied consistently. We actually can ask our physicians to perform a memory test as part of our annual physical, and also a memory test that typically consists of answering questions, and they last about 10 to 15 minutes and can be administered by doctors, physician assistants, psychologists, social workers, nurses, pharmacists, and other health professionals. The health professional administering the screening will review the results with you and may suggest a follow-up with another physician for more testing. For people looking for affordable screening options, the Alzheimer's Foundation of America does offer free confidential memory screenings Monday through Friday on secure video conferencing technology. Appointments, however, are needed to book a screening. Okay, so I'm going to go over with you some of the most frequently asked questions that are Googled on the internet, that I get asked, just to remind everybody. Probably one of the most frequently asked questions out there, and we've discussed this many times: is there a cure for Alzheimer's disease and dementia? The answer is still no. There is no cure for Alzheimer's disease and dementia. Another question: what causes Alzheimer's disease and dementia? We're not entirely sure, but research suggests that a combination of age-related changes in the brain, genetic, environmental, and lifestyle factors do contribute to our risk of developing it, though these do vary from person to person. How are Alzheimer's and dementia diagnosed? We do have more than one method that can be used to make an Alzheimer's or dementia diagnosis as best we can, not 100%, up to 90% is the latest statistic. And these can include neurological exams, brain imaging, MRI, PET scans, fluid and blood tests, memory assessments, cognitive and functional assessments, physical exams, and evaluations of the patient's medical history. So here are the key takeaways from today's episode. You can think of it like this: dementia is not necessarily a destiny for all of us, but nearly 45% of dementia cases are potentially preventable by managing the 14 modifiable risk factors like hearing loss, vision, and hypertension. And I went over them earlier in the episode. Structure beats solo effort. Following a structured, coached program like the US Pointer model is and has proven to be much more significantly effective at preventing cognitive decline than the self-guided lifestyle changes. Another takeaway, the rise of blood tests. The new p-tau217 blood tests allow for earlier, less invasive detection of Alzheimer's biology, shifting the focus toward proactive intervention before symptoms worsen. Brain health is vascular health. Controlling the triple threat, which is blood pressure, cholesterol, and diabetes, is the most direct way to prevent the brain injury that leads to cognitive impairment. So there you have it. Thanks again for being here with me today. I really appreciate everybody taking time out of their busy schedules to attend and watch this episode of the Truth, Lies, and Alzheimer Show. The sources for my episode will be in the show notes if you want to refer to them and dig a little deeper into what we talked about today. So in the meantime, as always, I will be back next week prepared with another new episode for you on this Truth, Lies, and Alzheimer's show. Once again, I'm Lisa Skinner, your host, and I hope you have a great rest of your week. In the meantime, stay happy, try to stay healthy, and I'll see you back here next week. Thanks again.
Thank you for listening to Truth, Lies, and Alzheimer's. We hope you found something in today's episode that helps. We understand that caring for a loved one with dementia can be the challenge of a lifetime, but you don't have to do it alone. If you're ready for exclusive access to even more great content and resources, head on over to Facebook and join Lisa's Minding Dementia Support Group. We're a community of like-minded caregivers, and we're here to help.